Okay, here we are with Nicole and Evan, and Evan came into our office, was referred by a friend of Nicole's. And Nicole, could you share, previous to Evan being a patient, what was going on with him and why did he come in?
So Evan, it started where one day he said that his legs felt funny, and when he was talking about it, it sounded similar to restless legs. So we figured that we would just kind of wait and watch. We took him to his doctor, and they did. Then his levels were low, but then he started. One day he came in, and his right leg was tremoring, just a fine shake, and it was just going. And then a couple days later, the left leg did it, and then the right leg, or both arms, left and right arms. And when the tremoring stopped, he was left with the tingling sensation, just 24 hours of tingling, not quite pins and needles, but tingling. So our pediatrician had sent us into a neurologist where they did MRIs and what else did they do? They did EEG, and we had it all done. And he was diagnosed with epilepsy, but we did not feel, and he was put on anti-seizure medication, which we did not agree with because we didn't feel that was it at all. He's passionate about soccer, that's his thing, and when he would pull himself from his game after 5 minutes in tears because his legs hurt so bad. We're like, no. So we kept searching, and we saw 4 different neurologists in the area. Pediatric specialists. We drove down to Olympia to see somebody who was highly recommended, and ultimately they just told us that it was in his head and that there was
no organic cause of it.
There was no cause for it.
But in the history, though, what as far as the history goes, what were the things that were feeding into this problem? He had a history of several.
He's had concussions.
Right. How many concussions? Not including the recent one.
Yeah.
Before he came to me, he had 3 or 4, right?
He had 3 or 4 before this, and all of these, we shared all of that with them.
Right.
And but so we were told that there was nothing wrong, and he's actually still on the waiting list. Almost a year later, to get into children's pain management clinic, and they told us that he'd have to talk with psychiatrists, and we're like, yeah, that's not it. So he went in, and he was in the hospital for 4 days to do a video EEG, and the night before we went in, I was talking to one of my friends, who she said, well, nerves, I've got the doctor for you. And I said, hey, we will do anything, huh?
Right.
So we came and
had an evaluation.
And
with all that testing that you did, they basically didn't find anything. How much do you think that all that testing cost, would you say?
Oh, thousands and thousands and thousands of dollars. I mean, with the MRIs and the EEGs.
How much do you think we're up to? 20, $30,000?
$40,000.
$30,000. With basically no reasonable explanation of why we're having the symptoms that we were. Okay.
$30,000 to $40,000 plus anti-seizure meds.
Right, and also there was some history of some ADHD as well, right? So you came into the office, we did a real thorough evaluation, we looked at how the brain was functioning, we also looked at his overall metabolic makeup, we put him on a protocol to address his metabolic issues that we found based on laboratory testing that we did, also neurological therapy, what we call brain-based therapy, to help his brain work better and to reduce inflammation from all the trauma that he had to the brain. And as a result of those therapies, what has changed?
Everything.
Everything has changed.
Yes.
And prior to you getting care, when there was no solution, what was that doing to you feeling positive about life, Evan?
Well, I felt kind of depressed.
You felt depressed, right? And one thing we didn't mention, you had a constant headache, everyday headache. It's terrible for anyone to have a headache every day, but someone so young to have a headache every day, it's awful.
And he had an amazing attitude throughout all of it.
Right.
He's just like, but after months, I mean, this went on for 7-8 months that we were dealing with
trying
this.
to find a solution.
And towards the end, then you just saw it. You saw the smile was gone, and he was getting sad, and he's like, "Am I going to have this forever?" I was like, "No, we're going to keep going." Yeah. And so when we came in for that first evaluation with you, I was ecstatic. I think we both were. We were both fascinating. So he's had experience with vision therapy and brain-based training, which we saw incredible improvements in numbers and whatnot.
As far as maybe cognitive ability, but not
Cognitive
necessarily
abilities.
symptoms as pain and
Exactly. No,
and
it was
function. As far as
definitely-
body function, no change there, but there were some improvements in scoring and things like that, cognitive wise.
Exactly.
Right.
And but for that evaluation, we were both just blown away by it. It was the most thorough evaluation, and it was
Right.
fascinating. As you
Yeah.
know, I was taking notes and asking questions,
Right.
and it was crazy. And you told us that day that, yeah, we've got this, you know.
Yeah,
And sure
it's going
enough,
to get better.
and so he was having, so the tingling sensation was constant, and he was having tremors, whether it was in a leg and an arm, both legs, both arms, 4, 5, 6 times a day for 7 months. And after first visit with you, he has not had a single tremor
Yeah, that's amazing.
since then, not a single tremor.
Right.
And then a few weeks after we started seeing you, Sweet Child got another concussion,
Yes,
which ended up
which
being
is-
a blessing in disguise because, as you said, we realized then that through treating that, that it was more neurological maybe than we had originally thought, because we saw such improvements. And so then what you learned from that, you were able to focus on, and then the tingling went, and I'll never forget.
Right,
I
and
think
the
you
daily
will.
headaches too.
And the daily headaches, those all ended, and
yeah.
I won't forget going out into the car that first time that, you know, there was this major adjustment, and he was mad because he said, I went from that tingling from a 7 and an 8 to a 2 in one day.
Yeah.
Why did those other doctors take so many months and tell me nothing was wrong? And that
Right,
was a huge
Yeah.
moment for us, wasn't it?
Big wins, yeah.
Mhm.
So we had major reductions in all the symptoms, improvement in some ADD tendencies as well.
He is off his medication since we started seeing you, and
yeah.
his teacher, my husband and I, we all, and Evan himself said to me one night, all within like a week, he said, I feel like a different person. And
Yeah.
his teacher, and I wrote her a note
Yeah.
and said, did you get on his case about this? She's like, no, I just assumed he had a big talking to at home.
Yeah.
So,
And so the results have been so good that now, Nicole, you're under care
I
as
am.
well. And also your dad, Stephen, is under care as
We're
well.
all here.
And there's also some similar issues with some ADD issues and some chronic pain. And you guys are progressing as well. And
inflammation and autoimmune and
yeah.
thyroid and all
Yeah,
that good
that's
stuff.
all that good
and
stuff.
It's been wonderful.
Great. Well, Nicole, if you knew somebody who had a chronic condition and wasn't seeing results, would you refer them to our office?
I refer people daily to you.
Okay, I appreciate that. Great. Such a great story. I'm so happy that we got this on video. Thanks so much.
Yeah, thank you.